Austin CyberKnife offers alternative treatment to typical radiation or surgery for cancer patients, and most patients can pick right back up with their normal activities even after being treated for a brain tumor. Dr. Doug Rivera is a radiation oncologist and medical director of Austin CyberKnife and Austin Cancer Center. He joins us with more, and May is National Brain Tumor Awareness Month, Doctor, so we're talking about that specifically. Can you explain the types of brain tumors that you treat?
Yeah, one of the common questions I get is, where do brain tumors come from, and more importantly, what are they? So there are really kind of two different types of brain cancers. Ones that are called primary. They start in the brain. Those can be something called benign or malignant. And benign ones mean they typically just grow right there, and they can grow very large, but they don't spread other places. And the other one is a malignant type or cancerous type. And those have the ability to maybe go to other parts of the brain, and in rare circumstances go outside of the brain. Though tumor actually is cancers that start outside of the brain and then may metastasize up to the brain, and those are called secondary tumors, and those actually are more common and occur in lots of different cancers, but predominantly lung cancer. And they are treated very, very differently in how we approach them.
Such a scary thing to think about. What are some of the symptoms that might come with those tumors?
It's a great question. The difficult part about it is that it's variable. So really it depends on where the tumors occur. And the brain being such a high functioning organ, it kind of controls the whole body. And so if you have a tumor that is in the area where it controls the vision, then maybe that might be a symptom that can be affected. But if it's somewhere by the pituitary, which is a hormonal organ, it can be just even a hormonal imbalance. But I'll say that it varies anywhere from just a simple thing as tiredness to headache, and in some severe circumstances, seizure, or even like stroke-like symptoms. And that's really difficulty in diagnosing it.
So the way you treat this, it's so precise, yet minimally to non-invasive. Tell us how you treat these tumors.
Yeah, so primary and malignant brain tumors are really, it's kind of a collaborative process in which we involve neurosurgeons, neuro-oncologists, and radiation oncologists in particular. And so how you treat a person for their type of tumor really depends on what type of tumor it is. But in generalities, the more common cancer, for example, metastatic lesion, those are typically either treated with surgery and most of the time probably with radiation. At the Austin CyberKnife, we do have various different physicians that we have in the collaborative process to diagnose and recommend treatment. But when we do treat for CyberKnife, this is a type of technology. It's a robotic piece of machinery, very highly advanced, and we use very small beams. And in doing that, we have a kind of very precise and accurate way in which we deliver treatment, and that helps to do that non-invasively, kind of outpatient setting. No pain required. And we get with that very good. And then also with very few side effects in general, because it is so precise and accurate.
That's amazing. You were saying that many people can, like you said, outpatient, resume their normal activities. I mean, that's phenomenal to me. It's kind of mind-blowing. Yeah,
we call it stereotactic radiosurgery. And so it sounds like there's some surgery there, but it really is, delivering things from the outside. People are laying down very comfortably and quietly, listening to music as the therapy goes on. And even though we may be doing something that would, if you did it surgically, would require hospitalization, ICU stay, they are literally treated within 30 to 40 minutes, and then they go home and live on.
That's fascinating. Thank you so much for explaining it to us. We appreciate you being here today, Doctor. And Austin CyberKnife is located on I-35. You can call them at 512-324-8060 or go to austincyberknife.com. Stay with us, checking out what's new in the world of